Sam Olson is a 2-year-old male that presents with his mother, who states that he's been running a fever for the past 2 days and pulling at his ears. The mother states that his ears are constantly hurting and it seems to be worse at night when he's lying down, making it hard for him to lie down. She also states that he's been coughing as well. She has been giving him 5 milliliters of Motrin every 6 hours for the pain and for the fever. Patient has no known allergies, no medication intolerances. Mother denies any past medical history, no chronic illnesses or major traumas, no hospitalizations or surgeries. The mother states that there are no significant family history. Patient lives with his parents and his 2 siblings. The mother denies any tobacco use, drug use, or alcohol use within the home. The mother denies any weight changes, fatigue, night sweats, energy level changes. She does report that the patient has had a fever. Mother denies any rashes, bruising, bleeding, or skin discolorations on the patient. Denies any delayed healing or changes in lesions or moles. The mother does report and that the patient has a wet sounding cough that comes and goes. Denies any wheezing, coughing up blood, shortness of breath, history of pneumonia or TB. Mother denies that the patient is having any changes in his vision or blurring. Mother denies any abdominal pain, nausea, vomiting, diarrhea, no constipation or eating issues. Mother does report that the patient has been having ear pain and pulling at his ears for the last 2 days. Denies any hearing loss, ringing of the ears, or any discharge from the ears. Mother denies the patient having any urgency, frequency, or burning, or a change in the color of his urine. Patient reports that Mother reports that the patient has been having several wet diapers a day. Mother denies any sinus issues, difficulty swallowing, nosebleeds, discharge from the nose. Denies any dental issues, hoarseness, or throat pain. The patient weighs 28 pounds. 39 degrees Celsius is his temperature. Blood pressure is 95/58. Respirations are 25. Pulse is 98. He is a well-appearing, well-nourished 2-year-old. He's alert and oriented. He has a normal mood and affect. He was ambulating in the room without difficulty. The head is normocephalic. No trauma was noted. No lesions noted. Hairs evenly distributed. No discharge from the eyes. EOMs are intact. Canals are without redness of the ears and are bilaterally clear. The bilateral tympanic membranes are red and are bulging, but there are no signs of drainage or perforation. Both tympanic membrane bony landmarks are visible. The nose nasal mucosa is pink and moist without lesions. There is a small amount of clear mucus present within both nares. The oral mucosa is pink and moist without lesions or discharge. Pharynx has no redness and is without exudate. S1 and S2 are heard with a regular rate and rhythm. There's no extra sounds, clicks, rubs, or murmurs noted. Capillary refills are 2 seconds and pulses are 3+ throughout. There's no edema noted. Respiratory, the patient's chest wall rises and falls symmetrically. Respirations are regular and easy without difficulty. Lung sounds are clear without. Differential diagnosis would include allergic rhinitis, which is characterized by sneezing, nasal congestion, clear discharge, and is thought to be a disease process limited to the nasal airway. Treatment would involve avoiding triggers, intranasal corticosteroids, and antihistamines if needed. Another differential is otitis externa, inflammation of the external auditory canal that can either be infectious or non-infectious. It often occurs during the summer and in tropical climates, and it can also be known as swimmer's ear. On examination, the ear canal would be red and edematous with yellow, white, or gray debris, and this can be ruled out based on the physical findings of the patient's external ear canal exam. Final diagnosis is acute otitis media, which is an infection within the middle of the ear, and it can be viral, bacterial, or a co-infection. It is diagnosed clinically and is based on findings on the physical examination. Symptoms include pulling and tugging at the ears, irritability, headache, restless sleep, poor feeding, vomiting, diarrhea, fever. Physical exam would reveal redness and or bulging tympanic membranes, and there may be fluid in the middle of the ear. Medications would involve amoxicillin, 80 to 90 milligrams per kilogram per day, by mouth twice a day for 10 days. Non-pharmacological recommendations would be warm compresses and hydration. No diagnostic tests needed. The patient's mother would need to be educated on avoiding tobacco smoke, educated on medication administration, and have the child to eat before taken to avoid GI upset. Educate the mother on ear care and to avoid water entering into the ears using things such as earplugs when swimming, and educate on warm compresses. Cultural considerations, you would want to get an understanding of the mother's opinion on antibiotics, because some parents are hesitant in using antibiotics as first-line treatment. Some parents prefer non-pharmacological methods first before initiating antibiotic use. So it would be important to educate the mother on the need for antibiotic use for this ear infection. Health promotion, we would ensure that vaccinations are up to date. In this patient, referrals, that would be based on how frequent the child has been diagnosed and treated for an ear infection, as well as treatment response. A referral to an ENT specialist may be considered. The patient would need to follow up in 1 week to ensure that antibiotics have been effective, and for an examination of the ears to ensure that the infection has cleared.